For decades, we have known about the dangers of smoking and its clear link to cancer. We've made progress in reducing smoking rates and saving lives, but a new threat is emerging. One often enjoyed in social settings and considered harmless by many: alcohol. The Surgeon General has issued a stark warning linking alcohol consumption to a growing number of cancer cases. This advisory, released on January 3, 2025, should serve as a wake-up call for all of us. Alcohol's impact on our health extends far beyond just liver damage or impaired judgment. It's a known carcinogen, meaning it can directly contribute to the development of cancer. This isn't about being puritanical. It's about arming ourselves with the facts to make informed decisions about our health. The evidence is clear. Alcohol consumption, even in moderation, carries a cancer risk. We need to understand the magnitude of this issue. The Surgeon General's advisory doesn't come without substantial evidence. Thousands of studies and years of research point to this undeniable link between alcohol and cancer. It's time we start treating alcohol consumption with the same seriousness we afford other known health risks. The Surgeon General's advisory is not meant to induce panic, but to promote awareness. It highlights a critical public health issue that often gets overshadowed by other concerns. For years, the focus has been on the immediate dangers of alcohol, like drunk driving accidents or liver disease. While these are serious issues, it's crucial to recognize the long-term, potentially fatal consequences of regular alcohol consumption cancer. The advisory emphasizes the preventable nature of these alcohol-related cancers. This is not about instilling fear, but empowering individuals to take control of their health. By understanding the risks associated with alcohol, people can make informed choices about their drinking habits. Knowledge is power, and in this case, it can be life-saving. The Surgeon General's report doesn't stand alone. Numerous health organizations, including the American Cancer Society and the World Health Organization, have been sounding the alarm on alcohol's link to cancer for years. This unified front from the medical community underscores the seriousness of this issue. It's a call to action for individuals, policymakers, and healthcare providers alike. The statistics are alarming. Alcohol is the third leading preventable cause of cancer in the US, after tobacco and obesity. It outranks a sedentary lifestyle and poor diet in cancer risk. Annually, 100,000 new cancer cases are due to alcohol. That's like a small city diagnosed with cancer each year. It's not just numbers, it's lives cut short. Alcohol causes 20,000 cancer deaths annually in the US. This surpasses alcohol-related traffic fatalities. Alcohol-related cancer deserves our attention. Alcohol increases the risk for at least 7 cancers: breast, colorectal, esophageal, liver, mouth, throat, and larynx. Alcohol's role as a tumor promoter is well documented. It interferes with the body's defenses, promoting tumor growth. Section 4. The public's blind spot: unmasking the risk. Despite the overwhelming evidence, a significant portion of the population remains unaware of the link between alcohol and cancer. Less than half of Americans recognize alcohol as a cancer risk factor, a concerning statistic that highlights a crucial gap in public health awareness. This lack of knowledge can have dire consequences, leading individuals to unknowingly put themselves at risk. Several factors contribute to this lack of awareness. For decades, messaging around alcohol has primarily focused on the immediate dangers, such as drunk driving and accidents. While these are critical issues, the long-term health consequences, particularly the risk of cancer, have often been overlooked in public health campaigns. Current warning labels on alcoholic beverages are woefully inadequate. Introduced in 1988, they solely address pregnancy risks and impaired driving. While these are important messages, they fail to reflect the full spectrum of alcohol's potential harm. The absence of any mention of cancer risk on these labels perpetuates the misconception that moderate alcohol consumption is harmless. Section 5. A call to action: protecting our health. The Surgeon General's advisory is a call to action on multiple fronts. It urges individuals to reassess their relationship with alcohol. But individual responsibility is only one piece of the puzzle. The advisory recommends updating warning labels to include cancer risk. This change could significantly impact public awareness. Clear warnings can prompt individuals to reconsider their drinking habits, The advisory calls for a societal shift in alcohol perception. This includes revisiting alcohol consumption guidelines and bolstering public health campaigns to educate the public. It's about ensuring access to accurate information. Alcohol's link to cancer is undeniable. By raising awareness and promoting education, we can save lives.